Okay, so today I'm going to be counseling Amelia, who is 28 years old. She's coming to the office for a well person exam. She would like to know more about the things she need to do to prepare for having a baby. She'd also like to get off of birth control, and she and her partner are smokers. So here we go. Okay, Amelia, thank you so much for coming into the office today for your well person exam. I understand that you and your boyfriend have been talking about having a baby soon, which is very exciting, and I'm glad that you've taken the first steps to coming in here to receive some counseling and perhaps do your labs as well, just to see where you are and how I can best serve you as your midwife today. So, I would definitely want to ask you some like preemptive questions about like your medical history, like if you have any medical conditions that I should know about, any family conditions, like things that are prevalent on your mother's side, your father's side, your siblings, um, medications that you might be on, allergies you'd like me to know about. It'd be nice to get like your gynecological and obstetrical history, like how old you were when you first had your period, the regularity of your cycles, any like history of STIs. Is this your first pregnancy? If when you and your partner decide to have a baby, will this be your first pregnancy? We definitely want to know when your last pap smear was, and if you are interested in getting a pap smear. Um, and then you mentioned that you and your partner are smokers, so that would go along the guidelines of like your social history of sort of the behavior of you guys is like smoking. How often do you do it? How many packs a day? Is it just tobacco, or do you also smoke marijuana? Do you also use alcohol? Um, Kind of like what's your diet like and your exercise routine, what you guys do for work, because it's good to know if your working environment imposes any like toxic exposures that we should know about, because those are also things that we can counsel you through, or I can counsel you through. And then I'd love to know a little bit about like your partner, sort of like if he has any medical conditions, kind of what's his behavior with smoking or any other type of recreational drug use. Um, and then we want to talk about uh, quitting smoking, I believe, before having a baby. So, yeah, smoking cessation is very, very important. It's important to know that smoking does decrease fertility, so it increases your chances of infertility and certain risks such as miscarriage, problems with the placenta, which can be very, very serious, preterm birth, low birth weight, and sudden infant death syndrome. So, would, how I would counsel you through that is to definitely, first of all, recommend that you quit smoking before pregnancy. And I would honestly recommend that you quit smoking maybe like 6 months before pregnancy, because even when you stop, that sort of those health risks and factors still linger in a person's body for quite a while. So it's recommended to, I would say, half a year of no smoking before deciding to get pregnant again. There are cessation programs here in San Diego that are free. Some are just online therapy counseling, some are more private. There's group. Um, we can talk about some nicotine alternatives that would be low impact for the pregnancy. Not all of them are recommended during pregnancy, but the priority is to get you to quit smoking before you get pregnant. And there's also like behavioral support. I'm also like someone who will be there to counsel and check on you and see how the programs are working for you. And then, of course, I also encourage your partner to quit. I would love to have them in here anytime you're in here for prenatal appointments or any other type of appointments that you have before you get pregnant, because I feel that these things typically see the best results when the partner is as active as they can be. So also you want to stop birth control pills. That's, I mean, obviously something you're going to have to do and consider if you'd like to get pregnant. So fertility can return quickly after stopping the pill, like within weeks to months. So a normal cycle, I'd say, can take like 1 to 3 months to regulate. So my recommendation is once you get off of birth control, to maybe clock about 3 months of what you would see as a normal cycle for you. So within the um 25 to 30-day span. And if there's some irregularity, we would discuss that, but it would be kind of your call if you'd like to try for pregnancy with irregular menstruation. It's sort of hard to know when your ovulation window is going to be, which is why I recommend waiting for like about three normal, not normal, regular, consistent cycles. Nutrition is also important. One of those things that help us when we want to quit smoking, quit birth control, get all these chemicals out of our body, all these toxins out of our body, is to start to replenish our bodies with a really good diet, amazing exercise. We want to talk about all the things that improve fertility. Now you're 28 years old. You're at a very viable age for pregnancy and fertility. So I wouldn't say that there's any like outside issues unless there are historical issues in your family that would impede on getting pregnant. But I'm not honestly too worried right now that like where you are in your age that you will have a problem getting pregnant. So there are some labs that we can discuss you taking before getting pregnant, and then there are some labs that we can discuss you taking in your first trimester. So I want to do a complete blood count, get your blood type and RH. That's just important so that when we find out what your baby's blood type is, we know that there's no crossing over of RHs. For example, if you're negative and the baby's positive, or vice versa. Definitely an STI screening. And okay, so now we've got the blood results. So looking at your blood test results, everything looks really nice. I'm seeing that the chloride is very high, which would probably indicate dehydration. Knowing that there's no liver or kidney issues in your family, I'm going to say at the moment that this is probably dehydration. You want to increase your water intake. Your CO2 is pretty low, which is probably from your years of smoking. It means you're kind of exacerbating your breath a little bit, so I would say that's from years of smoking. So what we would love to do is increase your exercise, more cardio related exercises like running and things that are going to improve your CO2 output. Glucose is also looking high. Again, that's looking like dehydration. We're seeing like a pattern of dehydration here with your blood results. So we definitely want you to increase your water intake. And then lastly, your creatinine is low, and that may be malnutrition and low muscle tone. What I would recommend is to uptick your protein intake and your water intake. Protein is so vital during pregnancy. It's like essential for fetal growth. So while you're taking this time to reassess your cycle and get off smoking, I'm recommending like a nutritional overhaul. Definitely increase your water intake, get that protein in there, improve your muscle tone. More muscle mass on your body actually is statistically shown to produce better, more viable babies and a more viable pregnancy as well. Okay, I think that's it. So thank you so much, Amelia. You did really, really well today. If you have any other questions, do not hesitate to reach out to me. Thank you.